So we're looking at the next infection, which we'll be talking about the definitive diagnosis of Pneumocystis Pneumonia. Right. So that means if this patient actually have this infection of the lungs, what are the things that when you see it, you can now say, okay, 100% you are sure that this patient has this issue. Okay. Pneumocystis pneumonia. So for the Pneumocystis pneumonia, we said that it actually occurs in individuals, all right, especially individuals that their immune system is very weak. So weak immune system is something that you commonly see in patients that has HIV and AIDS. Okay. So clinicians rely on what? Things that you can pick up with your eyes, and also things that will come back from the lab where you send samples of these patients so that they can actually do the test. So first of all, let's look at the diagnostic methods. You have to use staining techniques like the Gomori methenamine silver, Toluidine blue O, immunofluorescence staining. So you use them to actually dictate the microorganisms that are causing those issues. So of course, it's a lung infection, so the sample you are taking is a sample from the respiratory tract. So specimen that you take include things like sputum, bronchoalveolar lavage, lung tissues. Okay. So polymerase chain reaction, you can also test it just to pick up the Pneumocystis jirovecii, which is the microorganism causing the issue. So however, it may also dictate colonization, so results must be interpreted alongside clinical findings. So we're talking about the definitive diagnosis, right? So this one is like more of laboratory stuff. Okay. So beta D glucan assays, so elevated levels shows that there is issue. All right, then you do imaging like this, x-rays like this. Okay, so chest x-rays or CT scans can show bilateral interstitial infiltrates or ground glass appearance. That's how they call it. Okay, ground glass appearance. Can you see this? Sorry, let me take my picture away. Ground glass appearance. So clinical context, mostly if you now still confirm that the patient has HIV and AIDS, it's a very nice indication, So that's how we go about trying to diagnose this Pneumocystis pneumonia.